Welcome back. The internal capsule deserves special attention because its internal geography determines exactly what gets damaged with small lesions in this region. The genu, which means knee in Latin, referring to the bend in this structure, is the specific region through which corticobulbar fibers pass. These are the fibers heading toward cranial nerve motor nuclei in the brainstem, controlling functions like facial movement, chewing, swallowing, and speech. Just behind this bend lies the posterior limb of the internal capsule, which carries the corticospinal fibers destined for the limbs. This spatial separation between the genu and posterior limb has direct clinical consequences. A small hemorrhage or a tiny stroke, called a lacunar infarct, occurring precisely at the genu can selectively impair cranial nerve function, producing problems with face movement, swallowing, and speech, while leaving limb movement relatively intact. Conversely, a posterior limb lesion will more prominently affect arm and leg motor function. Because all motor fibers are densely packed together within the internal capsule, even a small lesion in this region can produce deficits affecting the face, arm, and leg relatively equally on the opposite side of the body. This is in contrast to cortical lesions where the motor fibers are spread over a much larger surface area, and damage tends to affect the limbs and face to different degrees depending on which patch of cortex is injured. Also, adjacent to the internal capsule is the dorsal thalamus. When thalamic lesions occur in this region, they can disrupt sensory relay pathways alongside the nearby motor pathways, producing combined sensory motor deficits, a presentation frequently seen in thalamic strokes. So in summary, the internal capsule is a compact white matter pathway divided into an anterior limb, genu, and posterior limb. The genu primarily carries corticobulbar fibers, whereas the posterior limb primarily carries corticospinal fibers and is clinically important because small lesions there can cause dense contralateral weakness. Vascularly, the genu and superior posterior limb are supplied mainly by middle cerebral artery lenticulostriate branches, while the inferior posterior limb is supplied by the anterior choroidal artery. Because motor fibers are tightly compacted in the internal capsule, even a very small internal capsular stroke can produce severe hemiplegia. Equal face, arm, leg weakness especially suggests a subcortical capsular lesion rather than a cortical lesion. Middle cerebral artery territory involvement of the interior limb and genu can contribute to contralateral face and arm predominant deficits, whereas subcortical lesions involving the internal capsule can cause equal weakness of the face, hand, and leg. In the next video, we will talk about the midbrain. Please make sure you are watching these videos in order for the best learning experience.